But that pale, pasty look to their skin, that's not normal. That puffiness that you're seeing, particularly in my son's face, not normal. When these kids get mold and mycotoxins exposures, one of the first things they do is they blow up. You'll find that these patients gain weight very quickly, and they do not lose it. You can see on the slide there the other things that you don't see. My son had a boil at the base of his spine, at his coccyx. He had semi-hemiplegic migraine headaches that would drop him for 10 to 12 hours a day, 4 to 5 days a week. My daughter developed numerous cold symptoms, things like that, flu back to back to back. And then finally, she ended up with pandas. And all of a sudden, I watched a bright, brilliant child drop to acting like a 3-year-old. Obsessive compulsive, lying, just behaviors that were completely not her. What was the source? 7 different water intrusions in a less than 5-year-old house. Not a single one of those water intrusions able to be seen. The only way we figured it out was when water started dripping out of the smoke detector. And that was after 5 years. So when someone says they don't have water damage in their house, they very well could have water damage going on and have not a clue about what is going on in the area around them. So just because someone says, I don't think I have an exposure, doesn't mean that they don't have exposure. We're finding some of the worst water damaged buildings are completely hidden from view. So the first thing that I always say is when you've got a chronic illness patient, get mold on the table. Let's talk about it. Let's look at the environmental factors that could be going on with that patient population. So ask those questions. And there's a lot more than this that we can get into and that you can ask as well. Find out what changes they've had. This is what really takes definitely a lot longer than a 7-minute doctor's visit. Because what you're going to want to do is you're going to need to be able to dive in and find out historically what has changed. When did they last feel well? And with many of them, they've had multiple exposures along a continuum of time, and then they get the straw that breaks the camel's back. And what's the straw that breaks the camel's back? Emotional stressor, car accident, something along that line that is a significant life stressor finally puts them over the edge. Air. This slide is compliments of Dr. Dennis, who I'm co-presenting with. Air is the most important factor to address. If you're not addressing air quality with your patients, you are missing a major component of their healing. The air you breathe, 5 times more important to your health than any treatment rendered by hospitals, doctors, or medication. Twice as important as your genetic code. And 60% of all deaths due to the air quality conditions at home and work. Okay, there's direct correlations there that Dr. Dennis has found. You need the HEPA filtration. Okay? Our homes are so tight today in how they're built, we're actually causing a lot of our issues with the products that we're using in our home and things like that. So you've got to get that off the table. So you have to do the HEPA filtration, and you have to filter for VOCs. You can't just do one or the other. You got to get both. There's some wonderful systems out there. The one that Dr. Jill Carnahan recommends, one of the top mold docs out there, is the Austin Air system. I find that the clients that I work with like it because it's simple. It is not technically the best out there as far as HEPA filtration goes. IQ Air actually claims a 99.97% rate for HEPA level filtration, and they have an ultra HEPA filtration level where they claim 99.5%, as small as a 0.003.